How do you put on your medi compression socks properly with the medi 2-in-1 donning and doffing aid? This video clip will give you some valuable tips because it's really easy once you know how. This video shows you how to put on a knee-high sock, a thigh-length stocking, and pantyhose properly. It's best if you put on your socks straight away after getting up in the morning. Please have your rubber gloves ready as well. You will use these later to smooth out the material over your leg more easily, or you can put them on immediately and wear them while you are putting the socks on too. The rubber gloves adhere particularly well to the sock and make donning much easier. You can buy special gloves for this from medical retailers, for example from a surgical appliance shop. Make sure you file your fingernails round and smooth before putting the stocking on. Pedicured heels and toenails are also important to prevent damage to the material. Please don't put on any jewelry or your wristwatch until you have finished putting the socks on. Please sit down to put on your compression sock. Lay the medi 2-in-1 donning aid flat on the floor in front of you. The long scarf-like end should face away from you. Fold the rounded end of the donning aid along the dotted line back towards you to form a double layer. Next, place your foot on the outlined area. Your toes should be pointing towards the folded edge. Now, push the fabric of the 2-in-1 between your big toe and the second toe so that it is held securely. Slide your hand into the sock down to the heel. Then grip the heel and hold it tight before turning the stocking inside out. Slide your foot into the sock and pull it up over your instep and heel towards your knee. The donning aid stays in the sock and pokes out of it at the calf. Make sure you only pull the sock up to about a hand's breadth below the knee at most. Lift your heel slightly to pull the donning aid out more easily. Finally, smooth the material evenly over your whole leg, from the heel up to the top of the cuff. It's best to wear medi's rubber gloves for this. They adhere particularly well to the material and make it much easier to put the sock on, position it correctly, and smooth out any wrinkles. Depending on the material and sock length, you can move the material back and forth on the leg with the rubber gloves, or grasp the sock with your fingertips, lift it up, and reposition it. Finally, check that the whole sock, the heel, and the cuff or top band fit properly. A knee-high sock ends about an inch below the hollow of the knee. The top of a thigh-length stocking ends lower than an inch below the gluteal fold. A tip for your thigh-length stocking: grasp the stocking by the material when putting it on to protect the seam of the top band. Medi 2-in-1 gives you the greatest possible help when putting your compression socks on and taking them off. The sock effortlessly glides over your instep and heel almost by itself. Medi 2-in-1 is suitable for all sock lengths and sizes with closed toes. The practical daily helper fits neatly in your handbag, so you can always rely on it, even on journeys. By the way, medi 2-in-1 is very easy to care for. It can be machine washed in the delicate cycle at 40 degrees Celsius and simply left to dry. Socks are so simple to put on using medi's donning and doffing aids, so you can get the day started even more quickly with your fashionable compression stockings. Medi, I feel better.